computer. So I'm going to start letting them in. They're you guys are unmuted, but if you start to be noisy, just mute yourself, okay? So I'm going to admit them in, okay?
Hey.
There they go. So you guys can start admitting also. Let's see, joining.
Are you keeping up the questions, or are you going to stop sharing that?
Well, we'll get to the questions at the end, the very end.
So do you want to stop sharing that? Because if you don't share it, we'll be able to see everybody's face. With that, we can't see everybody.
Yeah,
Linda, you're backlit like you're in protection. Yeah.
So, okay. Welcome everybody. This is Dr. Rogu from RBK Pediatrics. We're doing our first ever Zoom meeting. We figured, heck, if the children can do it, why couldn't we, right? Well, I have everybody on mute, but I'm going to unmute you a little bit later so you can ask questions and you know, we can interact a little bit more. So it looks like we have a good number of physicians on the line. We got Dr. Riley, Maria Malazzo, Dr. Simon, Dr. Rosshalder, Dr. Linda Lukos, Dr. Stein, Dr. Belvin, Dr. Scott, and Dr. Raymond. Hello. And we have a bunch of patients that seem to be on telephones. Here's some more. So I want to thank our pediatric families for allowing us to take care of your children. And we just want to reiterate that RBK has always been here for the community, and we're still here for the community. We are operating. We did not close down the offices like many places did. Our urgent care is fully operational. And, you know, we're here to help as much as we can. We have plenty of equipment. We're protected. The staff is protected. The patients are protected. I'm going to start with giving Dr. Riley control. He's going to give us a little bit of an update on what's going on with COVID and how it affects us in the pediatric world. So, Dr. Riley?
Hi. So thank you first for letting me into your home. And today we're going to talk a little bit about the COVID-19. Next.
Hi, it's Dr. Nicholas Rogu here. I was just helping Bill Sierra, our PA, get online as well. Sorry for that. He's getting there.
Can you mute Nick, I guess?
Okay.
So I guess the first thing is, you know, what is COVID-19, right? And I think by now everybody realizes that it's a virus, that it's spread mainly, we feel, through droplets that come out of your mouth, especially when you're coughing, sneezing, but also as you're talking, right? And currently, unfortunately, there's no vaccine to prevent the coronavirus, although Dr. Fauci has kind of optimistically said that hopefully by next year in January there will be one. It seems that although the first picture talks about washing doorknobs and things like that, it does seem like that mainly spread is between people. And usually it is within close contact with people, and as they've done their studies, it seems like most of the exposures have been within the same home exposures, right? Next. One of the things that I want to talk about is to watch for symptoms. So hopefully most people in Long Island don't have experience with this, but the symptoms usually will occur 2 to 14 days after you were exposed to the virus. Usually the symptoms predominantly we've seen are cough, shortness of breath, or difficulty breathing. I would say that when I've talked to patients, and for myself, it was more of a sort of a heaviness inside their chest, where they would take a deep breath and they felt like they were having problems, almost like getting enough oxygen. It is also felt that usually you would have fever, chills, muscle aches, headaches. It does seem like some people have sore throat, although their throats are usually not very red. And one of the things that definitely seems particularly unique to this kind of virus is that they'll lose the ability to have any kind of discern smells and tastes and things like that. And really that seems to be a real kind of hallmark for luckily, we haven't really seen a lot of really sick people. You know, children, they can get all these things. So usually when your kids get sick, you're going to be wanting to ask them if they have any of these kind of symptoms. But they really are not really getting too sick, actually. They seem to actually be doing it very well, right? It's really the adults that we have to worry about. Can you get me the next slide? So what do we do to help spread, right? So I think everybody knows they need to wash their hands, right? So usually for little kids, you try to make it into a game. So when you're washing your hands, you could sing happy birthday to you, since it's Dr. McGill's birthday. It's the kind of thing, if you could do that twice, then you've washed your hands long enough. Certainly if you guys are sick, we don't want people going out, right? It is the kind of thing that we're all together in this. And if you're home, if you stay home, like I said, most of the people who get sick, they get it from someone in their own home, but you don't want to actually start another epidemic in someone else's house. And if you are sick and you are at home, you want to be able to cover your mouth. You want to avoid close contact with anyone in your house. You want to isolate yourself as much as possible. You want to make sure that you're cleaning all the surfaces, especially any surface that someone else may have touched. And really, it's that kind of thing that you want to just basically stay away from people as much as possible behind a closed door. Next slide. So this slide, I just wanted to kind of let people know that when there's an epidemic, usually that means that a sick person is going to be getting other people sick. And this is really why we see a downward trend right now, because people have been doing a good job not becoming like this slide shows, where they got sick and then they ended up getting more people sick. So it is actually incumbent on every single person. If they are starting to feel sick, they have to isolate themselves. They have to make sure that they're not exposing anybody else in the community. So I guess, what do we do as pediatricians if we find someone who's sick, right? Next slide. So we do testing, right? So there's different ways that you could test people for the COVID, right? Now, I would say that most of my patients don't look like this little girl so happy to get her nose swabbed, but that is actually currently what we're doing right now. We swab people. The positives for the nasal swab is that it's a very sophisticated kind of test, and it's fairly accurate for it. The downsides are that when I swab someone for the COVID, I'm exposing myself to the virus, so we're ideally trying not to do this as much as possible. The kids usually, like I said, are not big fans. And the tests are not the most accurate kind of tests in the world. So it is the kind of thing that, we will swab someone if we feel like it's clinically important, but we don't necessarily swab everyone, and not everybody who has actually the COVID actually requires nasal swab. In the middle of May, apparently I just got an update from Dr. Rogu that hopefully at that time, we're going to be able to expand our testing, and we're going to be able to simply poke someone's finger and be able to see if they've currently been exposed or if they've been exposed in the past, right? These tests are the same as any other test. So when we do that test on patients, we're going to have a little bit of a chat with you, certainly, just to let you know what the results mean. But we're very excited to be able to do this, right? And certainly it's the kind of thing that we're going to be letting people know as soon as it's available. Next slide. So, yeah, so when you're a parent, you have to talk to your children about the coronavirus, but it is the kind of thing that there's a way to do everything. Next slide. Thank you. So you have to kind of realize that when you're talking to your children, you want to make sure that you're kind of taking into account their level of understanding. And there is a thing that anxiety is contagious. So it is the kind of thing you want to remain calm and reassuring as you're talking to them, right? If you seem anxious, upset, it is the kind of thing that even if the kids don't really understand what's going on, they do pick up on these cues. It is something that a 2-year-old, for example, if they see their parents upset or anxious, they are going to actually kind of mimic that kind of stuff, and it is actually going to get you into trouble. Because we don't really know a lot of time what the kids are really thinking, you want to be there for them, right? So I tell people all the time, parenting is a volume business, right? So this is a time where you kind of want to be able to ask questions for them, but not questions that necessarily are going to be anxiety provoking, right? Like you wouldn't say, how worried are you, right? But certainly if they bring things up, that's usually a good opportunity to kind of find out what are they thinking. Yeah, so it is very clear, the more people watch things about the coronavirus, the more upset they get, especially if they start talking about you know, unfortunate things that have happened to people who got sick, right? So you really do want to monitor them, and you want to be able to really keep track of that kind of stuff, especially, you know, your child. If your child is a kid prone to anxiety, then you perhaps maybe want to make sure that they're not watching anything that would kind of like cause the anxiety to be worse, right? And then certainly it's the kind of thing you want to talk to your children about, spreading of germs. Certainly, usually all of us are staying at home right now, but it does seem that it is going to be coming that kids are going to be allowed to go out now in the next month or so. So it's the kind of thing, just teaching them common sense kind of things, basically things that you probably are doing all the time. But it is the kind of thing that, you know, you want to emphasize it, especially as you start, once again, going out and about, right? But yeah, I guess one of the things that I should just kind of say, depending on how old the child is, especially if there are other things going on in your family or other people who are getting sick with the COVID, it really is not a lie. The kids actually do great with the COVID. So you can actually say with 100% assurity and without actually thinking you're saying something wrong, that the kids are actually much better off than anybody else. They actually do very well. Could you give me the next slide, please? So what else are we doing? I don't know if everyone on the line actually realizes, but we're actually kind of starting to do a lot of telemedicine visits. Dr. Ragu was the first one to do this in our office, but now everybody is actually doing these kind of special visits. And it's a visit very similar to this, where we're using Anytime Pediatrics, and it allows us to actually have encounters with patients without actually bringing them into the office, right? Which a lot of patients actually appreciate. And certainly we do a lot of things like med renewals, and certainly I've had the experience where parents hold their child's behind up to the camera so they could show me their diaper rash, right? And it is actually very good. And certainly parents, you know, when they're having questions, they're not sure, is this something I should come into the office? This is definitely one of the things I find a lot of parents actually really, really appreciate, because it is actually a very good tool for us. And hopefully it'll be something that we'll be able to use even in the coming years. Next slide, please. So yeah, so what do I do if I'm sick, right? So it is the kind of thing that if you're very sick, certainly you might have to come and see us, which is not a big deal. We're doing a lot of things to make sure that we separate the well children from the sick people. But most of the people, what they're doing now is they're scheduling a telemedicine visit to kind of talk to us to see if there's anything they can do. And this is actually really good, because you can actually call us very early on in the illness and find, is there anything else that you could do? Is this something that is there any other guidance that I need, right? If you do come to the office, like if you talk to Dr. Nick and he says, yeah, I think this is something that you have to come to the office, then we would say, especially if you're coughing, we would want you to do the same way like you're going to any kind of store, like when you go food shopping, to wear a face covering and things like that, and to try to be careful not to spread virus. Next slide. So it is the kind of thing, we've changed how we do things in our office right now. So in the mornings, we actually only have well children. So like some days in the morning, I just see tons of little babies that they're coming in for their shots. And then in the afternoon, that's when we're actually saving time for sick children. But to tell you the truth, there's not really that many sick children, right? Actually, everyone has gotten very healthy since they're not going to school. So, but it is the kind of thing that we're kind of cleaning, and we have a lot of disinfectants and Santa Claus and bleach and all these things that we're doing in between the patients to make sure that everything is as sterile as possible. But you know, again, like I said, it is the kind of thing that if you're not really sure, certainly you can always call us first, and we can actually schedule a telemedicine visit and find out if it's something that needs our hands-on approach. All right, I think that's good. So, Dr. Ragu, back to you.
Okay. So, I'd like to share with you another, where'd it go? Basically, I'm just going to have the physicians on the front line tell us about their experience on what's going on. So I was going to have Dr. Nick maybe tell us what his thoughts are on what is the office doing, cleaning and things like that, PPE.
Okay, can you guys hear me?
Yeah.
Okay, hi, I'm Dr. Nick Rogu. So just expanding on what Dr. Riley had discussed, we are taking this very seriously, and all 3 of our locations are constantly being disinfected between patients. We are segregating the well in the morning and sick in the afternoon if there are any to be seen. We're doing these telemedicine visits, but also we're doing appropriate usage of personal protective gear. We're definitely encouraging all of our patients to come in wearing masks, limit to 1 parent per patient coming in. And we are asking everyone to actually call in and get curbside check-ins. So they actually wait in their car until the room is ready. And then once the room is disinfected and available, then they are called and told to come straight in through room 1, room 2, room 3, whatever it is. And then from there, they can actually get everything done, their medical services, and then in a timely manner, obviously. And then they can exit the building, and they don't even need to go to the checkout counter if it can be avoided. Okay. This method has definitely shown to be helpful in reducing the transmission of this virus and any other viruses. So we plan on continuing doing this as long as it's necessary, and instituting more measures if it becomes necessary.
So basically, we have eliminated the waiting room. You're waiting in your car. The idea is not to get in fast. The idea is to get out of the building fast. So if you're going to wait, you're going to be waiting in the car. We'll get you in pretty quickly. The doctor will see you pretty quickly and get you out. Now, Dr. Belivan will tell us a little bit about what we're doing with the appointments themselves.
Okay, so yes, as excuse me, as Dr. Riley said, we've segregated the well visits and the sick visits, with the well in the morning and the sick in the afternoon. And when we say well, it would be, you know, someone who's not sick. So if you just need immunizations for, say, your 3rd, 2nd HPV, you have a rash that's not contagious, other things like that, where you're not sick, but it's not a quote unquote well visit. And we would see you in the morning, along with the other wells, because you're not, someone who would be contagious. And as Dr. Rogu was talking about the waiting room, my wife was asking me the other day that she was reading how doctors have tape up in the waiting room, like lines where people should stand and be 6 feet apart. And I said, there's hardly anyone in the waiting room nowadays. We don't even really need to watch that. There's maybe one person sitting there waiting for someone. And we've really been able to keep that empty. And then, when you get to the office, you're in the car, and we have you come in. We make sure the room is clean before you get here. So I think we've, really done a good job eliminating any waiting and commingling of the patient. So I think we're doing as well as we can with that.
All right. Dr. Riley, why don't you tell us a little bit about the plan that we have for future virtual well visits, possibly. We don't know yet if we're going to do this. We're going to try it. People seem to try it.
So this is the hard one, right? Because it's one of the things that we don't know exactly how it's going to work. And part of it is that, my life now is every day something new happens on how I practice medicine, which nothing different changed for 20 years, but now it's a little bit different every day. But our hope is, just like Dr. Belivan was saying, so that way we can get people in and out, that we will in the future be able to like use some of our telemedicine abilities to talk to the patients regarding all the different kind of things that you see when we talk about when they come to the well visits, right? About smoking and drinking and all these different kinds of things for the older kids, and for what kind of foods to feed, and all the different kinds of things that we do when they're in kindergarten. But we'll do that virtually. And then we'll have more of a streamlined process where the patient will come in, quickly get checked, and then get their vaccines. Now, exactly how that's going to happen, I'm unsure, right? So that is going to be a wait and see kind of thing, but there will be updates for patients. And we will kind of be able to post it, or probably Dr. will be able to post it through Solution Reach. But it is something that is exciting, so I would say stay tuned.
Yeah. You know, the reason we didn't do it yet was because of the weather. It's been really cold outside. Now the weather seems to be cooperating. I'll tell you a little bit about our telemedicine. Everybody's doing telemedicine. I've been doing it even before COVID. For medication renewals and things like that, it works really, really well. For little pediatric cases, little things, I have to admit, it kind of works. It does keep people out of the office, but if there's really, you know, the child is really small, or if the child is really, really sick, you know, I would recommend that you still do a hands-on visit if you need a blood test or something, because, you know, our urgent care is here. So we have some of our urgent care physicians, Dr. Rothwalder, Christine, Deborah, Linda, if you want to say something about our urgent care. You guys there?
Yeah, so, I mean, I work in the urgent care often, and, you know, if there's any need after hours, we're always there. You can call us if you want to call before you come in, you know, and then we can know that you're coming, anticipate that, and make sure that we get you in without exposing you to other people in the urgent care. And of course, you know, we're always available. So.
Yeah, we need to mention that we eliminated the walk-ins over there. This way we can control who's coming in, and people are waiting in the car. And then when the room is available, the physician's available, we call you on down to room number 2. So there's no waiting in the waiting room in that place either. Unfortunately, we did lose the walk-in capabilities, because then we're going to have a waiting room again. People are going to be sitting. Now we want to talk about some perspectives at 375. Either Dr. Raymond, I'm not sure if he's having some technical difficulties, or Dr. Scott. You guys work there a lot. What's going on over there?
Can you hear me?
Okay, Dr. Raymond, great. You fixed it.
Yeah, I pressed some buttons and so it's working.
So
Well,
how's life over there?
Greetings to everybody. I would like to touch on 2 points. One is that every day we are learning something new about this virus, its presentations, both in adults, youngsters, as well as children. So the parents should be aware that even though the disease is much less frequent, much less in children, but it still can happen. And there have been deaths in children too. What has been recently reported is rashes of different kinds as the only symptoms in children, hives, urticaria, Kawasaki disease-like syndrome, and lately, yesterday or day before, there were a number of reports of what they call the COVID toes, where you get chilblains-like lesions on the toes, and then some of them on the fingers too. So just be aware of that. Some of those things may be visible through the camera. Some of those things you may have to come into the office. The second point that I just want to make, there was a question asked about pregnancy and COVID and the babies, the newborn. I think anxiety it's very important that the expectant mother be mentally well prepared and not be very anxious about the whole thing. I know it's a difficult situation. Sometimes all the answers are not there. Protocols about newborn care. Hello. that looks like Nick Jr. Protocols have varied from hospital to hospital, how they're going to deal with babies. But my advice would be, I've always been a big advocate of nursing, that plan to nurse your babies. It gives them some added advantage, and you can nurse the baby, you can wear a glove, you can wear masks if necessary. Try to nurse the baby as long as you can exclusively. Of course, the formulas are always there. And if a need arises where the baby has to be separated from the mother, if the mother has developed significant sickness, then that will be dealt with by the adult doctors in the intensive care. Get good night's sleep, eat well, keep your nutrition up, and hygiene for yourself and your children. This is not only for COVID period now, this should be forever, ever, ever. Thank you.
Yeah, and just remember, Dr. Raymond is high risk, but he's there coming to take care of your children. So let's say thank you to Dr. Raymond.
Thank you.
There
Thank you.
every single day. But
Yeah.
people need to come see you. There's no reason to keep Dr. Raymond in the office exposed if nobody wants to visit him.
As you know, I'm up there in age.
Yeah.
I'm a little bit obese, but the biggest risk factor I have is I'm an insulin-dependent diabetic, even though it's under excellent control. And I'm also hypertensive under excellent control. So need a little bit of prayers from everybody.
Yeah, you'll be good, Dr. Raymond. Now, before we go into the COVID testing, Dr. Riley, why don't you tell us about your fears with vaccines and the decrease in the vaccines that we're sending out messages all the time?
Yeah, so unfortunately, this is a thing, right, where some people have already gotten phone calls with my voice because they're infants and they're not actually getting the vaccines the way they're supposed to, right? And it is the kind of thing that the problem is that people, I think that they're more afraid of the COVID than they are of these kind of illnesses. But these illnesses, they still happen, right? It is actually a thing that we have to be, we have to be cognizant, we have to be aware that when, it is the kind of thing that it's not okay, especially if you're less than 2 and you're supposed to be getting your vaccines, to put them off, because we schedule the vaccines at certain times because the vaccine only gives you antibodies for a certain period of time. And it is a thing where, I definitely have seen it even in the office where one of the doctors, their sibling did not get the vaccines the way they were supposed to, and then the kid ended up getting very sick and ended up having big problems. So it is the kind of thing, it's very important for everyone to get the vaccines on time.
I had myself, my name came up. Your mic is so low.
Oh, I'm sorry, I hear people talking.
Yeah, so Dr. Riley, I just want to share a piece of information from my history. Back when I was an intern, I got the measles because I was of the generation that could have had 1 shot or 2. Somehow it got missed and I only had 1. Working in a measles epidemic, Dr. Rogu had the measles. Not a fun disease, and it's gonna come back. I've seen so many measles cases back in that time, I can consider myself an expert in measles. So vaccines are very, very, very important. Please do not delay. We're gonna get over this COVID. We don't need a measles epidemic or a whooping cough epidemic or a flu epidemic or something, polio epidemic, God forbid.
No, even the rotavirus. The last kid I saw who died, I still have nightmares, right? That was from the rotavirus before we had the vaccine. It's a problem.
Some of us in the RBK practice, Dr. Raymond, Dr. Belvin, Dr. Riley, myself, we've all seen these childhood illnesses to one extreme or the other. Some of the younger people may have not. It always entertains me when they come over and they ask me a question about chickenpox. Young physicians they don't know how to recognize it sometimes because they fortunately, they don't have to deal with it because of the vaccines. Now, our last topic that I want to talk about.
Can I say something about the vaccines? We have to remember that, when close to 100% of the people have it and maybe you didn't, there's less people that are unvaccinated. There's very few unvaccinated people for you to get it from. But if more and more people don't get the vaccine and percentage goes down to 90 or 80%, then it's much more likely that these vaccine preventable illnesses will go around. And so it's kind of a vicious cycle. As more and more people don't get it, we have to be more concerned.
Well, that's exactly the reason. I didn't have the vaccine properly, and I was working in a measles epidemic in the emergency room, and then I got it.
Right.
Yeah, you've heard the term herd immunity much on TV lately. And if we don't give the regular vaccines, we're going to lose that herd immunity on all those diseases.
All right, Dr. Riley or Dr. Nick, I'm not sure who wants to just chat a little bit about our next plan with the COVID antibody testing tent thing.
I guess Nick, right?
Is he there?
Sure, I'm back.
All right, go ahead.
Hi, guys. So for the COVID antibody testing, we're looking to institute this testing in an outdoor environment at our medical tent, Comac location. I don't know if some of you saw the video that was posted recently, but I put out a little.
I didn't see it.
Oh, okay. Well, it's on its way. In any case, it'll be a small finger prick like they do in the office. It takes about 15 minutes to run. And it'll tell you if you had previous infection or are currently infected.
Okay. Well, that's what we have. And before, when we sent out this registration, I asked people for some questions. And I had a slew of questions. Let's try to answer these things. What additional steps are being taken by the nurses and the doctors in between patients? I've repeated over and over again. We are cleaning, double cleaning. People don't come in when there's well checkups. There's no sick. I've had people that called in and somehow made it. We send them away. We tell them to come back at 3 o'clock. We promised our patients that we will not have patients in there. Will shots be administered outside tent? If we get that project off the ground, I think we may be doing that. I heard kids won't get the virus, especially if they have asthma or anemia. Kids can get the virus. We've had a number of kids that had the virus, but they do very, very well. Sometimes they'll have a little bit of a fever, a little bit of a cold, and other than that, they're pretty okay. I mean, I can tell you personal experience. I had it back in late March. I had a little cold, cough, body aches, chills, sleepy, loss of taste, and then I got back. Most of the people in the population will present like that unless you have an underlying high-risk condition. Dr. Riley, you want to take care of some of these questions?
Just interesting about the asthma kind of stuff. It is a thing that if you talk to some of the ICU people and if you see interviews with them, that it's not as much about the asthma. It's more the stuff that Dr. Raymond was talking about. It's the sugar kind of stuff. So that is the thing that I've been telling people, that it seems like the coronavirus has a sweet tooth, that it seems to like people who are perhaps having issues related to sugar, like prediabetes or hypertension and things like that. So one of the things that when I counsel people, I usually say to them to get enough sleep, to exercise, but especially to watch the food. So certainly when I was sick as well, my diet was mostly meat and vegetable, because it seems like that actually puts your immune system into a state that allows you to fight off the coronavirus the best.
All right. So I'm gonna, any of the other doctors of RBK, if they want to chime in, or I can assign. Dr. Simon, I know you're on the line. How can we help our children stay safe and build a healthy immune system?
Yes. Well, one of the main things, can everybody hear me?
Yeah.
Okay. One of the main things is sleep. I always love to talk about sleep, but more than ever, there are significant even medical studies coming out about how sleep is where your body manages to build up its immune system and rest and, you know, reboot for the next day. So make sure we're getting adequate sleep and in the normal relative rhythms that we're used to. So you can't have these kids falling asleep at 3 in the morning and then sleeping till 2 in the afternoon. It's just not going to be a good situation. So let's, you know, keep them, you know, sleeping well, normal hours. Let's also get them outside for daylight, sunshine, which we have a beautiful day. Dr. Riley doesn't need the fake backdrop today because the sky in Comac looks exactly the same. So we need, you know, there's studies about vitamin D. Go outside today, get some vitamin D. That's going to help us. Good nutrition as best as you can. I know it's hard to get into the supermarket, but really let's get, you know, breakfast, lunch, and dinner in the kids. Keep up vegetables and fruits where we could find them, because we want to keep the good balance of vitamins in our system as well.
Actually, your newsletter went out yesterday where you did your little video on this. So that's a good thing. Now I'll take this one as how soon, when the vaccine is going to be available, how soon will RBK be offering it? I promise you, when that vaccine comes out, RBK will be one of the first practices giving it. We are big enough to matter to a lot of these companies, so we will have it. And then we will figure out how to give it to people. 2.5-year-old checkup, is it necessary? Dr. Riley spoke about this a million times. Yes, it's very important. Food handling and ordering food. I mean, wash the stuff. Common sense kind of things, like Dr. Raymond said. Will the antibody testing be available, even if they don't have a history of COVID tests? Dr. Riley, what do you think of that?
Yeah, it's the kind of thing that basically it'll be to all comers. Anybody that wants to get it, they can get it, because there is actually a very well-known phenomenon where you can be asymptomatic. That it seems like a lot of people may have had the COVID and they didn't actually realize it. And it would be actually something nice to know if you could actually do a blood test and see if you have antibodies. Although it wouldn't mean that you could disregard everything that we were talking about before, wearing masks, things like that. I still wear a mask when I go outside, but it is the kind of thing that it definitely would kind of make us feel better.
Yeah, actually, Maria, why don't you tell us about what project we're trying to do, Maria?
Sure. Thanks, George. Thanks, everybody, for joining us today. We're thinking on the days that we set up for the COVID antibody testing to actually be collecting some information from each of the kids that comes in for testing to see if they've had any of the common complaints or symptoms that we know of right now for COVID-19, and try to get a picture of what this illness would look like in healthy kids in our community. So we have a lot of information about older adults or adults with this, but we really don't know what it looks like very well for healthy kids. And so along with the COVID testing, we'll be asking some very specific questions about symptoms, and we may be very surprised to find numbers of kids that have been infected and have recovered, and families, and we never even knew that the kids were sick. So that's
we're actually going to set up our EHR to be able to cross-reference and run reports of positive tests, negative tests with symptoms, and do some population health management out of it. What steps are used to clean the entrance? We don't have a waiting room. We have a separate bathroom for sick, a separate bathroom for wells. Here's a good question. I'm due on baby number 3 on June 1st. What will the procedures be for newborn well checks? They'll be coming in early in the morning. We will see them in the hospital as we usually do. And, there are no sick people when they come in. We still take care of the little babies. Can parents get the antibody test? I am thinking probably not. We have a limited amount. We were able to secure about 1,200 doses. And that's going to go very, very fast. If we have extra doses, then sure, we'll do that. But right now, it's just going to be just for, I would think, pediatric. What do the other doctors think? Anybody else want to comment?
I would agree. if we don't have enough, we have to, do our patients first. But if in a few months, maybe they'll be more freed up, then we could do that.
Yeah. Here's a good question for
I'm sorry, on that also, it would be good in terms of just public health, if we test the children and they're positive, then the parent then could do it as a, outpatient. They don't probably need a rapid test. They can get that kind of to a lab from their own physician.
Here's a good question for Dr. Scott. What to expect in the pediatric populations if the schools reopen, and what would be the role of the pediatrician on that one?
Well, when the schools reopen, the most important thing is going to be continuing all the standard precautions that we've all started now for the COVID, all the hand washing, the sanitizing, making sure everybody's covering their mouths, that kind of thing. So when schools reopen and we all get back to normal again, it's important we still continue those preventative kind of measures to make sure we don't catch COVID or really anything else. That's precautions work for the flu, any viruses, colds, that kind of stuff. So that's probably going to be the biggest thing that we can remember to do once schools and everything reopen.
Yeah.
All schools are closed till September in New York State.
Yeah.
So everybody's information.
And then we have, here's a good one for Dr. Stein. When is it safe to hug your children after being diagnosed? She there?
I'm here. I was unmuting.
Ah.
I would say that while you're having symptoms, it probably is best if you don't. If you wear a mask and you wash your hands, I think it's safe to hug your kids.
Yeah.
Yeah, and the AAP guidelines on this, the current ones, are that even mothers who are positive are advised to stay clear of the babies, but they're still allowed to breastfeed so long as they appropriately use the gloves and masks while they do it.
There's the question of, I am concerned that many parents may be afraid to bring their kids for the immunization and physicals. Dr. Riley, your reassurance words are requested.
Yeah, so it is the kind of thing, like you've heard multiple times already, that we separate everyone. So that way it's the kind of thing, we only have well children. And it is the kind of thing that we're cleaning and it is the kind of thing that not getting physicals and not getting the vaccines are not safe. And even putting them off puts you at risk. So I would say that it definitely is much, much safer to come in, get your vaccines, and protect yourself from all these other diseases that we've conquered, which a lot of them are very 100% much worse for children than the COVID.
Yeah. And actually, there was a question here about how do the children present with symptoms? Are they the same as an adult? I personally have seen a bunch of positive kids. Because I was positive, I felt like Superman. I tested everybody. You know, I've seen kids where they came in with just fever. I had just the other day, a baby fever, 3 months old. The mother and the father were both nurses at a nursing home. Parents were negative. The baby was positive, had a fever for a day or two. A lot of kids presented with cough, cold, congestion. I had today a kid with the COVID toes, like Dr. Raymond was talking about. I think that would be the first one. And that sensation of loss of taste and smell, that seems to be a big one in the adolescents.
Also some GI.
Some GI issues, yes. So, but you know, fortunately, we're very fortunate that the children do very, very well. Now, there's a question over here, could be the last one. Are you still able to perform the specialty consults, the pediatric weight, the asthma, the ADHD through telemedicine or in the office? Dr. Nick, why don't you take that one?
So yes, we are still open and widely available to doing in-office consultations. We do them in a separate consult room that's not used for medical. And basically the rooms are also clean to the same standard. They're spaced out, so there's no waiting in the waiting room. The parents wait in the car. They do a curbside check-in, and then when the room is available, they come right in. It's just myself or Dr. Riley or Mr. Sierra or whoever else is doing consults at the time with the parent only at times. Some of these consults are parent only initial, for example, for the ADHD, and then the follow-ups are with the children. and the weight management as well. I think we're trying to get a little more flexible with that. And we're also offering the option to do telemedicine consults for these specialty visits to keep things on track. I think especially now with school being in the situation that it is causing quite a stress on the parents who are perhaps working from home and trying to be teachers to their children at the same time. And I'm one of them, and it's very stressful. So I would say this would be a good time to get these consults, which are usually very difficult to come by during the routine school year. So we actually have more time in which to do them now. So I would encourage everyone who was thinking about getting their consultations performed to go ahead and contact us, because we can accommodate them in various manners. In office, morning hours, we can do in office, afternoon hours through telemedicine, also afternoon hours in the office, because it is a separate office that we're doing it in.
Yeah. And then there's a question here about medical refills, medication refills. I mean, I've been doing the Ritalin and the ADHD med refill since the summer. I don't think people are coming in for that. And if they're still coming in, they should get an account with Anytime Pediatrics. I think we have our office manager here, Kathy Lavigna. She had something that she wanted to share with us. Kathy? She's unmuted. There we go. There we go. Kathy?
Yep. Can you
Go
hear me?
ahead. Yeah, why don't you?
I just wanted to encourage anybody who this time of year, they need paperwork for, you know, copies of the kids' immunizations, if there is a summer camp this year, or a copy of their well checkups, that there's several ways that we can get that to them. We could put it into our portal and they can print it from there, if they have access to a fax machine. But in some of the offices, we have a lot of people coming in, you know, through the front door without, you know, us saying, you know, please wait in the car, we'll come and get you. So, you know, give us a call. If it can be done without walking into the office, then do that.
All right.
And George, Dr. Rogo, I just wanted to say, we talked a lot about not putting off well visits.
Yeah.
But one of the things that's hard to do by telemedicine are things like ear pain and sore throat. So I don't think people at this point should be afraid to bring their kids in for those type of urgent care visits. That oftentimes delaying, you know, what is starting to happen even in the adult world is that people are delaying care to physicians, and then when they actually present for routine things, they're a lot sicker than they would have been had they gotten to medical attention earlier. So urgent care is open, and again, we're using the same procedures where they're not waiting in the waiting room. They're getting into rooms, they're being seen fairly timely, and they're getting out. So people shouldn't be afraid to bring their kids in if they really feel like they need to be seen in person.
I agree. I've been asking a lot of patients, how are you doing? How's your family? And you would not believe how many people share with me that 35-year-old parents, 40-year-old, 30-year-old, young people. Doc, I've been sick with the COVID and I was in the hospital. I said, tell me your story. And the story is always the same. I'm sick. I'm a little sick. I'm not that sick. I wait. I get a little sicker. I call the doctor, who is closed, unlike RBK. I sleep. I'm resting. I'm quarantining. I get really, really sick. A week goes by with fevers. Then they go get a test and they tell them, go quarantine yourself. You get a result in 10 days, or they don't even do the test. The person is getting sick, can't breathe. 2 weeks go by of fever. The test comes back positive, then they go to the emergency room, and these people were sick. I think it's delayed care. You're just not going.
I'm not even talking about COVID though. I'm talking about regular ear infection, strep throat.
Yeah,
just
absolutely. But the theory is the same. I agree with you. I think Dr. Scott had something you wanted to say.
Oh yeah, I just wanted to actually tie up a bunch of points that everybody's been making so far. And I think Dr. Stein's question there was another good example to tie together. There's still so much that we don't know about this. Like Dr. Raymond was saying, that every day we're getting new information, and the things that we have to do and think about, both from the perspective of a physician and as a parent and as from the child, it's changing. So we have to start practicing different ourselves, start weighing risks, benefits of coming into the office, going out in public and stuff like that too. So to Dr. Rogu's point that we're now able to utilize this telemedicine, there's no reason at all to let anything sit, let anything wait. If you have any questions, concerns, anything like that, it's very easy to give us a call. And if we need to set up a telemedicine appointment, we'll do that. If we say you need to come in for an exam, we'll do that. But there's no reason not to call us and ask if there's any question.
Yeah. Tracy or Bill, if you guys are on the line, if you want to share something with your experiences, I didn't get to pick on you guys. No sharing? Okay. Maybe I wonder if the parents that are on the call, if I can unmute everybody, if we can do this in a nice way. If you raise your hand. Tracy, do you have something you want to share?
Oh, sorry. It took a while to figure out how to unmute. No, I think that, as the time has gone by, you can tell that the families are definitely encouraged by what we're doing in the office. And we can definitely see that the well visits are starting to pick up and they're coming in for the vaccines again. So that's also very encouraging.
Yeah.
So I think you just keep up the good work.
Yeah, we're trying. We're trying. We didn't give up. So I guess we're good. Dr. Riley? I think, are any more underlying questions out there? I think we got them all.
No, I think that's good. But I think this is the first of a few. So if someone has more questions, we can save it for next time.
Yeah. All right. I'll just people can raise their hand and I'll see it. If there's any questions, we can unmute them. I'm almost afraid to unmute everybody because you can hear dogs and stuff. All right, here we go. Marcy Kaplan, she has a question.
Hi.
Hi.
So I have twin 12-year-olds
Okay.
who are, for various reasons, anxious about coming in. They're due for a second HPV vaccine in a couple of weeks. One has a fear of illness. The other has a terror of needles. So my first question is, what can I say to them to let them, particularly the one who's more fearful of illness, to sort of calm her down? And then the second question is, since they are twins and the rule is one parent per child, can I bring my husband?
Oh, okay. That's a tough one. Tracy's actually going to be doing a video for us to send out in a newsletter on the HPV. So Tracy, you want to take that one?
Sure. So as far as getting the HPV vaccine, the visits for getting the vaccine itself are very quick. So you really just walk right in as soon as you tell them that you're outside. The doctor comes and sees you for a very brief second, does a quick exam, and then the nurse comes in, just gives a shot, and then, you're free to go after that. The good part about getting the HPV vaccine early, since I believe you said your children are 12, before they're 15, they only require 2 doses. So it's a good opportunity for them to come in and make sure they don't fall behind with the vaccine. And it's also, important to build up the antibodies to protect against the things that HPV vaccine protects against. As far as the fact that, you have twins, if they weren't in the same room, then theoretically, you can have one parent with one and one with the other, if that would, make them more amenable to wanting to come into the visit and, relax them a little bit and keep them more at ease.
Yeah, I think that's a good plan. We can work it out. Don't worry.
And just reiterate again that we are sterilizing every room completely between every single patient. Immunization visits are in the morning, so no sick patients have even entered the office that day yet. So we're doing a lot to try and keep the office clean and keep the kids safe. So reassurance is probably a good tool for her.
Oh, actually, there was a question here in the chat. It's a good one. Dr. Belvin, you can take this one. Are toddlers expected to wear a face mask during their well visits? I think...
Yeah, go ahead.
Go ahead.
No, it's obviously hard for the real, small children to wear it. I mean, you could try, but as much as we can do, the more we can do to keep them safe is better. But if they won't, then, we'll do the best we can. We're all wearing masks, and, all the nurses, all the staff, everyone's wearing masks and gloves. So we really, try to keep it very safe.
We do the best we can. That's what it
I think
is.
it also depends on the cooperation of the toddler. I've seen some 2-year-olds with masks and gloves come on with the gloves, rubber bands around them to keep them from falling off, and masks. They think it's pretty cool to wear a mask. Others will refuse to wear it. So it really just depends on the situation. But we definitely are doing our part to keep everybody safe, and there should be no concern about not coming in because the toddler is not wearing a mask.
Here's another question in the chat. Should we keep our specialist appointments for our children? I believe my child is stable. You know, the specialist, I know for a fact the Good Samaritan Specialty Care Center, they're doing just like us. They don't have sick patients in the building. They're doing their best they can. So I would keep your appointments. It's important.
And if they cancel your appointments, if their clinics aren't open, call us and at least come see us so we can make sure that nothing gets out of control without anybody keeping eyes on it.
Right.
I also think it depends on the specialty. Some of them are doing telemed.
They're doing telemed also. There was a question here, how will you prioritize antibody testing? Good question for Dr. Riley. I don't know the answer to that.
We're going to, we should have enough, right? It was the kind of thing that we purchase as much as we can. So we're going to prioritize it for our patients. And in reality, the COVID-19, it's a little bit different. You know, when you get the testing, it's not like it really actually changes any kind of way that you're going to be managing anything, right? So I think probably in the beginning, we're going to have it open and then we'll see who's actually interested, right? Because we've had talks with other pediatricians and for some reason they seem to be of the opinion that there's not going to be a lot of people who are going to want to get tested. So we'll see, right? We did buy a ton of tests, so hopefully we won't be stuck with them. I don't think that's going to be a problem.
No, we have about 1,200 tests, I think. We'll do them. So I guess we're going to be sending a newsletter out probably today or tomorrow, and it's going to be telling you to request an appointment. It's not an appointment. It's just putting your name on a waiting list. And when we get the test physically in the building, we'll be calling you on down. I would suggest you do that. Do not call the office for this because it's not going to be an appointment. It's just a waiting list. Go onto the online request, and we're going to keep the list and then work off of that. So I guess it could be a first come, first serve.
And just remember too, just like we don't know still a lot about COVID and how it works, the antibodies also, there are still a lot of questions about what the results of that test actually mean. Like Dr. Riley said, how it's going to change how we treat people, diagnose people. So we still don't know a lot about the test itself. We need more experience with it too. So just testing everybody is not a great idea either, just because it's not going to mean a whole lot maybe.
Yeah. So I don't think, my thoughts exactly, Dr. Nick, not sure if, okay. I don't see any more questions in the chat. I don't see any more hands raised. I think we can end it now, unless anybody wants to raise their hand now before. Oh, we go, Wendy. Okay.
Hello.
Hi,
Can you hear me?
Yeah.
Hi. I just wanted to let folks know I had been to City MD in the past, and I got an email from them, I think last week, that they are doing the antibody testing. So if parents or relatives or other caretakers are interested in getting the antibody test, you could try City MD as an option.
Yeah, they're doing that for parents. Thank you.
You are.
I have one last aside. I actually was out in the world a little bit yesterday. You know, now the governor and local communities opened up a little bit. People saw sunlight and they just started to do really dumb things. So during our well care, telemedicines, even if they're asking about something else, parents who are on the line, just remember, all the rules and things we mentioned before still hold true. If you're going for a bike ride, kids should be wearing helmets. If they're going to be in a small area in your neighborhood, they should wear masks if there's a chance you're going to be within 6 feet of another person. I mean, just really simple stuff. I saw groups, herds of people walking together, unmasked, bicyclists, unhelmeted. It was just a hot mess yesterday. So doctors, remember, if you're on the phone or telemedicine with families, just remind them of our basics. Let's not forget that. And parents that are on the line, tell your friends, tell your neighbors. If you see something, say something. You know, we're all in this together and just trying to stay safe. And the sooner we could tap this COVID down, the sooner we'll be able to go back to what was the norm.
All right, so we're going to end it here. I just want to leave you with our regular RBK tagline. RBK is primary care when you want it, urgent care when you need it. We are here all the time. Tell your friends, Facebook, Instagram, TikTok, whatever you got, tell it about us, okay?
MySpace.
MySpace. We are one of the few practices that are open. All these doctors have been working. I've been working. Everybody's been working. So please come and visit us and say hello. Okay? Thank you. Bye-bye, guys. My favorite part. Bye, Bellevin.
Bye.
Thank you.
Bye-bye, guys.
Does this program actually close or does it just minimize over and over again?
What's that?
We hear you.
Get rid of them. Watch, it's my favorite.
Hi guys, can you hear me?
Yeah, anybody want to say anything?
Took forever to figure this thing out.
Jeez.
I had to.
What happened to your hair, Bill? I haven't seen you.
I know. I missed you. So
What happened?
I did was finally I unplugged the camera from the USB port, replugged it back in, and it worked.
Yeah. All righty. So
Go figure.
Anything else?
No, that's it. Very good. Nice guys.
George, it was great.
Bye-bye. Thank you.
Later.
Bye.
Bye, guys.